Hi everybody, and welcome back to another episode here on my YouTube channel, Dr. Carolina Sweldo. I am a double board certified OBGYN and fertility specialist here on this channel to provide information about all things surrounding fertility. Now, if you watched last week's episode, you'll know that I've been chatting with you about my journey in October. October was an extremely busy month for me. I finally have had some time to sit down, catch my breath, and reflect. And I wanted to share with you all a few, let's just say, items or orders of business that seemed important to touch upon as we navigate this journey together. Remember, I'm learning just as much as you are in all of this. So last week we talked about podcast interviews. And if you're somebody who commutes every day to work here and there, instead of turning on the radio, I encourage you to explore these podcasts. One of my mentors, she calls it Automobile University, and it's been very enlightening for me in my own life. This week, I want to talk to you about all the IG lives and the collaborations that I have done on social media. And the first question I usually get asked is, a doctor on social media, are you sure you want to do that? There's still, to this day, stigma surrounding medical professionals on social media. Insert the platform, Instagram, Facebook, TikTok, Twitter, etc. I am not technologically savvy to be on all of them, so you will find me mainly on Instagram, although I do have an account linked to a business page on Facebook. And really my goal there is to educate, nurture my audience, inform the people. There was a statistic that was published showing that over 40% of Americans consume their health information on social media. So guess what? If that's where 40% of Americans are, then that's where I need to be. I've been fortunate to have a very supportive and loving following who have been with me since the very beginning. I've had the account now on and off for a couple of years, but most active definitely I would say in 2022, probably since about May. So this has definitely been the year I've been most active on social media. And initially I started with publishing my own content. So, I do motivational Mondays, keeping it real Wednesdays. So you'll see a reel from me here or there, and then a fertility fact Friday. But I wanted to include these Instagram lives because I wanted to invite people to come on to my channel for my viewers and share their piece of advice, their 2 cents, their expertise, right? Because what can I provide? I can provide infertility knowledge. I'm trained, I'm certified, I've been in practice over 7 years now. But I'm not gonna know about, things like intrinsic bias. I'm not gonna know about things like integrative medicine, herbalism, things like that. I'm not a psychiatrist. I can't talk to you about, psychiatric disorders and their impact in fertility. But I know a lot of experts who do. So one of the beautiful things of being in medicine is the incredible community and collaborative effort. Many of us go into this specialty, or this field, I should say, to help people. And so back when I decided I wanted to do the IG Lives, I reached out to my network of physicians and said, hey, this is what I'd like to do. If you have a topic, or if you are a specialist in a topic that you think may apply to my infertility community, please reach out. And literally, guys, within 3 hours, I had IG Lives booked from May, June through the end of the year. It was truly something incredible. So if you go to my channel on Instagram, again, Dr. Carolina Sweldo, I tried to keep it nice and easy, the same across the way. You will find that every Friday, or most Fridays, I shouldn't say every, because when I'm in the operating room or on vacation, I don't do them. But most Fridays, you will find an interview with a different specialist of some sort, somebody sharing their journey and what they're specialized in and how that applies to the infertility community. So I've been doing those. In the last 5-6 months, I've done a total of 17. I was also fortunate enough to guest on 2 Facebook Lives for other physicians, both of whom are primary care. For those that don't know, primary care is a family practice position or sort of a generalist physician. So they're the ones who will be your first line of defense. They're the ones who you're going to see for your earaches, your headaches, your coughs, all the ailments. You'll start with them, and then they would, based on need, refer you to a specialist. So working with primary care is super important because the more informed they are, the more informed their population is, then the better the job we do as a medical community of educating our patients about infertility. So what has my biggest takeaway been from doing the IG Lives? Really, it's been the learning that I have done as well. So every week when I do these weekly episodes, I get to learn something new too. I have had a sleep specialist, I have had an acupuncturist, I have had a psychiatrist, I have had a gynecologist, I mean, you name it, and they've been on. And I hope to continue to do them because really they've been transformational for me as well as hopefully my audience. I have really changed the way that I counsel, the things that I'm looking at, the things that are important, and really making sure that I'm identifying and managing or counseling about all pillars of health, not just strictly the fertility, the pelvic organs piece. So the Instagram Lives are important. If you follow me on social media, I would love for you to comment below and tell me which episode was your favorite. Which guest was your favorite? Who would you like to see back again after the new year? If you have not already, please subscribe to the channel and invite a friend. As I mentioned last week, infertility affects 1 in 8. We know that loss affects 1 in 4 women of reproductive age. So you know that there is someone in your community that would benefit from this channel and this information. Looking forward to seeing you next week. Bye-bye now.